Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Nick Hakimi Salihin bin Masrul. My number matric is 058334. Then my lecturer name is Wan Azima and Wan Azlina. First, I want to thank for my lecturer for encouraging me to finish this slide. So, the title that I choose is Lateral Projection for Humerus. So, for this slide, to make it more easier this time, I use the concept of basement. So, the basement have 7 alphabets. So, the first is P. P is for position. A is for alignment. C is for collimation. E is for exposure factor. M is for marker, A is for aesthetic, and N is for name. So, in the beginning, before that, for your knowledge, the features that I will tell you today is the criteria for approving a radiograph using the 7 aspects that I mentioned earlier. It is the placement. So, we can go to the first slide of this PowerPoint. The first slide is about the position. So the patient is preferably erect. So it is to make it easier for a person to get a good image to give to the doctor. So patient is then rotated so that the lateral aspect of the shoulder of the affected side, the arm, and the elbow are all in contact with the upright bucket, right here and right here. So the elbow is flat 90 degrees, as close to 90 degrees as possible, like this. Okay. The Place the patient hand on their axis or stomach to maintain the position. This should be done as best as possible by a radiographer to get the best position for the patient. The patient also stands facing the detector with the injured side closest to the detector. So that's all for position. Then we go to the second slide. So the alignment. So the alignment actually is explained about the alignment of anatomical structure with image receptor or table and structure that should be included inside the projection. So, long axis of humerus should be aligned parallel with the midline of image receptor. So, that should so the structure that need to be included in this lateral projection for humerus is shoulder joint, elbow joint, and lateral humerus soft tissue. So the shoulder joint is right here. The elbow joint is right here. And the lateral humerus soft tissue is right here. So then we go to the next slide. So the next slide is about the collimation. So the collimation, the of center of the collimation field should be to the approximate midpoint of the humerus, right here. So for collimation, we have three. It is at the superior border, at both lateral border, and at the inferior border. So for the superior border, we need we need to collimate the clavicle, scapula, and humeral head right here. Clavicle, humeral head, and scapula. So at both lateral border, we need to collimate clavicle, scapula, and trochlea. At the inferior border, we need to collimate the humerus right here, radius, it is right here, and ulna, it is right here. So that's for collimation. Then we go to the exposure factor. So for the exposure factor, we use 60 to 70 kVp and with 7 to 50 MAS. So the contrast resolution should be adequate to demonstrate proximal body and distal humerus. So it is about surrounding soft tissue, bony trabecular pattern inside spongy structure, the cortical outline of the bones. So the good exposure for lateral humerus, the bony trabecular pattern and cortical outline of humerus defined. So this is the example of the best exposure factor. It is look good. And here this is a bad exposure factor. This may be about this may be because of the high KVP or high MAS. So that is for exposure factor. Then we go to the marker. So the marker, the plumbar marker should have evidence in the radiograph. So as we see here, you look at here, it is the L for left. For this is the plumbar marker. It need to be right here in the radiograph. And also the marker should be in the right position of the radiograph. So it is left right here. If it is right, we need to use the right marker. So the marker should not superimposing with any region of interest. So the marker is need to be it need to be right here, and it is supposed to be superimposing. So that is for marker. Then we go to the aesthetic. So for the aesthetic, we have film size, film orientation, and present on artifact. So actually, the film size is about 14 to 17 inches of humerus, right here. The orientation must be a lengthwise, and there is no presence of artifact included on radiograph. So that is for aesthetic. Then we go to the last one. It is a name. So for the name, the patient ID must be present on film right here. This is the sample of the patient ID on the film of radiograph. So the patient ID must include four types of this. First, the full name. As you can see, this is the full name of the sample, Muhammad Safwan. Okay. Then we have registration number right here. Exam date right here. And the hospital or department right here. So that's all from me. Thank you very much.